Hi students, this is Dr. Tatum. This should be my final recording for chapter 7. So I'm going to start on slide 18 where it talks about education for self-management. So during the prenatal period is a time for us to really educate our patient about some of the most pertinent things during pregnancy to help her prepare for labor as well as postpartum. So the first one is nutrition. It's really important to tell her if she is of average weight, so she has a normal BMI level, it's really important that she gains at least 25 to 35 pounds throughout pregnancy. We want her to have a healthy diet full of fruits and vegetables and protein. We want her to have adequate fiber in her diet to help decrease her chances of getting constipated and having hemorrhoids. It's really important that we stress the importance of taking a prenatal vitamin every day, and this should continue throughout pregnancy. And if she decides to breastfeed, this should continue throughout lactation as well. It's also important to tell her to limit her caffeine intake if possible. As far as personal hygiene goes, just make note that those sebaceous glands increase in activity during pregnancy. So she might find out that she's sweating more. Telling her just to have good, adequate hygiene, taking warm baths or showers is also going to help relieve any muscle tension or aches that she could be experiencing, especially as pregnancy progresses. Usually in that second and third trimester, it's not uncommon to have some backaches and some lower lumbar pain. And just make note that that heat is going to help relax some of those muscles for her. Also, prevention of urinary tract infections. So there are lots of different changes that take place in our renal system. And so some women will have asymptomatic UTIs. And so it's so important to have her wipe from front to back, use good hand hygiene, make sure that she's avoiding bubble baths with oils, just because sometimes that can be really irritating to the urethra. Keep in mind that progesterone kind of relaxes everything. And so that urinary sphincter is going to be relaxed and it's going to allow more bacteria to ascend up into the bladder. And so she is at higher risk for urinary tract infections. She's also at risk for yeast infections. So wearing cotton underwear is really important. Avoid any tight fitting underpants that could create a lot of moisture and heat, and it could be a breeding ground for bacteria. We want her to drink lots of fluid throughout the day, so at least 2 liters of fluid throughout the day. And then also just increasing her intake of yogurt because yogurt is a great product that helps protect against yeast infections. Other things, Kegel exercises. Kegel exercises are just that deliberate contraction and relaxation of those pelvic muscles, and that's going to increase muscle tone. It's going to decrease the risk of urinary incontinence late in pregnancy, as well as into the early postpartum period. Preparation for the breastfeeding newborn. So really assessing her breasts. So thinking about her nipples, are they flat? Are they inverted? If they are flat or inverted, then it might be nice for her to start using some breast shells. And you're thinking, what are breast shells, Tatum? Breast shells are basically really nice devices that she can actually put inside her bra during the third trimester. And what these shells do is they put gentle pressure around the areola and causes the nipple to pull out. So basically the nipple becomes more pointy and so the baby can latch on more adequately and efficiently in that early transition period. So there's a picture of breast shells in your PowerPoint on the next slide. And you can see what they look like. They're just placed in the bra. And really it's kind of like a dome-shaped device is what it is. But she can use those throughout the third trimester. And she can, usually it's for about a couple hours a day, but that time can gradually be increased as well. Tell her too that if she is preparing to lactate, to only use water when she is washing her breasts. Just the soap can be really drying and irritating to the nipple, and so it's important that she makes note of that and only uses water. Dental care is also very important. Thinking back to the first trimester where she has lots of nausea and vomiting with morning sickness, sometimes even just brushing her teeth or the taste of the toothpaste can make her sick to her stomach. But it's so important to keep emphasizing good dental care. She needs to go to her checkups pretty regularly. But if she does have periodontal disease, where she has cavities or gum hypertrophy, we know that research has showed that there's an increase in preterm births, low birth weight babies, and also an increased risk for preeclampsia if she does not adequately take care of her mouth. And so just a good thing to educate her on, making sure that she is keeping her dental appointments and brushing regularly, as well as flossing regularly is important. All right, moving on to the next slide. This is what a brush gel looks like. And again, it's placed in her bra. And these are usually used for inverted or flat nipples. All right, moving on to physical activity. Physical activity is very important during pregnancy. It's going to increase her circulation and well-being. It's going to help promote rest as well and relaxation. She's probably going to sleep better at night. It does counteract boredom as well. So maintaining good physical activity throughout pregnancy is advised. It's recommended. We want her to do that. Now, if it is strenuous exercise, so maybe she's running 5 miles a day. When she gets into that third trimester, it may not be recommended, and we tell her to talk with her physician about that. So if there are specific exercises that she does routinely, tell her to talk with her doctor. Most likely she can keep doing her same regimen, but if it is really strenuous, then she really needs to talk with her practitioner or her doctor. As far as posture and mechanics, we know that musculature changes and hormone changes during pregnancy. So there is a hormone called relaxin that is secreted during pregnancy, and this makes her pelvic joints softer, more relaxed, more flexible. However, because of that, that can create more back pain throughout pregnancy, just because more stress is placed on the abdominal organs. And as pregnancy progresses and the weight of that uterus increases, her center of gravity changes as well. So more stress is placed on her abdomen. She does have poor posture, especially as pregnancy progresses. We talked a little bit about that lordosis that can occur, where she kind of walks with a sway back. And that also increases the lumbosacral curve. And so tell her just to make sure that she is rising slowly, that she's getting up slowly. We want to protect her from falls if at all possible. Also, rest and relaxation. Make sure that she's planning rest periods throughout the day. When she is resting, make sure she is using a side lying position, just because that's going to help promote better circulation to the fetus. And then when she does get up, tell her to rise slowly, because that prevents strain. And then we also worry about orthostatic hypotension with pregnancy. So when she is getting up, if she's feeling dizzy or faint, tell her to sit down and wait a few minutes before she tries to get up again. As far as changes in employment, usually employment does not really affect pregnancy. It doesn't have many adverse effects. Most women can work up until their due date. However, depending on what their occupation is, there are some risky occupations. For those women that work in dry cleaning plants, chemistry labs, parking garages, just because of the fumes, the chemicals that are being produced in that environment, a lot of times that can cause more adverse effects. And so that might be something that their physician talks with them about. We also worry about those that have sedentary jobs. So if she is sitting for long periods of time, remember that she is at higher risk for blood clots. We want her to get up and move around if at all possible. We don't want her to cross her legs, because crossing her legs can predispose her to an increased risk in blood clots as well. If she's standing too long, maybe she is a cashier and all she does is stand in the checkout line for hours at a time, that can increase her risk for preterm labor. So make sure she is having rest periods throughout the day. As far as clothing goes, make sure her clothing is comfortable. We recommend maternity clothes just because her belly is going to be growing. Make sure that she's wearing a comfortable supportive bra. Support hose like TED hose can be really, really beneficial for her, especially as pregnancy progresses. And make sure that she's wearing comfortable shoes because that's really going to help with her posture as well and decrease her risk for falls. As far as travel goes, if her pregnancy is high risk, we tell her to avoid any travel for long periods. Now, if she is driving long distances and she has a healthy pregnancy with no pre-existing conditions, then we want her to get out and move around every hour that she's on the road. All right, moving on. This next slide just talks about some of the exercises that can be done. Pelvic rocking is something nice. That's what you see in letter A that helps relieve a lower backache. And so you can see that she is tightening and relaxing her stomach muscles here. In letter B, we tell her to stand against the wall and we want her to tighten her tummy muscles and tuck in her buttocks so that the small of her back is flat against the wall. Letters C and D shows different abdominal breathing techniques. So basically she is tightening her lower tummy muscles and buttocks, and she is using abdominal breathing in these exercises. And so that helps just lift those abdominal muscles off the uterus and sometimes helps ease that pain in the lower back. All right, moving on to slide 22. Other things to educate her on, medications and herbal preparations. Really, medications are pretty limited in that first trimester just because the risk for birth defects. So something that needs to be discussed with her doctor. And if she is used to taking prescribed medications, hopefully those medications can be adjusted accordingly. As far as immunization goes, we don't want her to have any live attenuated viruses given to her. We only want dead or weakened viruses given to her. So things like tetanus, diphtheria, the hepatitis B, and flu vaccines, those are all fine to give, but nothing live that could cause teratogenic effects in the baby. As far as alcohol goes, we want her to abstain from alcohol. That is kind of the best thing to tell her, the best option, I guess, at this point in time. Smoking, we know that increased risk for low birth weight babies. We always worry about asthma in babies that are exposed to secondhand smoke, and even just the risk for intrauterine growth restriction, just because the vessels are all constricted because of that nicotine. So make sure that she understands the risk involved. Smoking can also increase preterm labor. It can increase the risk for premature rupture of membranes. It can cause a placental abruption where the placenta detaches from the uterine wall. And it can also lead to placenta previa. So there's lots of risk factors associated with smoking. We strongly encourage her to stop smoking. Caffeine always increases the risk for miscarriage. So if she drinks more than 200 milligrams of caffeine a day, that puts her at risk for miscarriage. So make sure that she understands that caffeine is okay in limited amounts. So if she's a coffee drinker, maybe limit to just 1 cup of coffee a day. Make sure that she understands the complications, the risk for potential complications, and when to call the doctor. So calling the doctor if she's having any vaginal bleeding, decreased fetal movement, if she is feeling like her blood pressure is really high or she's having a lot of heart palpitations, or if she's noticing a gush or trickle of fluid from her vagina. Those are all indications that she needs to go in and see her doctor. And then also recognizing preterm labor as well. And so knowing when to call, and you guys can go back and review the signs and symptoms of preterm labor. All right. This will be the last slide that I'm going to be talking about. And so this is just an example of a C-band. Basically, these are used as an acupressure point for nausea. So if mom has lots of problems with morning sickness, she can use these C-bands. And they do work for a lot of women. So it's kind of interesting. All right, the rest of this chapter then I want you guys to review on your own. Definitely take a look at page 225 where it talks about sexual counseling and self-management. There are some good points to review there. Otherwise, thank you for listening.